Scott Jenkins with the Thunderbirds, and we're here with our next installment of the In the Community Conversations. I'm happy to have Nikki Kuntz, Clinical Director of Teen Lifeline. Good afternoon. How are we doing?
Wonderful. Thank you so much for this opportunity, and it's lovely to be able to see someone's face and to talk to people outside.
So can you tell us a little bit about Teen Lifeline and your role with the organization?
So Teen Lifeline is probably best known for our crisis hotline services. We've actually been a member of the community and a part of the community for now nearly 35 years. Coming up soon on another anniversary. We are part of the crisis system, but the unique thing is that we are a teen peer counseling crisis hotline for teens and children across the state of Arizona. We're the only one in the state. We work closely with the other crisis lines that are in the state that work primarily with adults and part of the mental health system. And we are only one of 6 peer counseling lines across the nation. So what we do is we take calls and texts from kids and teenagers that are struggling, give them a place to talk, to open up with no judgment, a place where they are listened to and heard and feel like they can make a connection to hope. But the unique part about us is that we actually train teens to take calls on the hotline and be that person for them. And so they oftentimes struggle to connect with adults right away. So Teen Lifeline gives them that place where they get to talk to someone who understands what it's like to be a teenager right now. And I think right now, with everything going on with COVID-19, that's even more important.
Tell us a little bit about, obviously the changes and what you're seeing, in the effect of the COVID-19, pandemic on our teens.
Okay. Interestingly, what we're seeing kind of across the state is that most of the crisis lines haven't actually been increasing their calls, but we actually are seeing an increase of calls. We also do take text messaging. So every day we take texts from kids as well who are struggling. Kids are calling about anxiety issues. They are calling about bullying. They are calling about issues at school and fear of not of failing and all of the things that they normally do. But it's exacerbated by this feeling of not being able to escape. There's a certain amount of activity they can do, but they can't do that in the confines of school where there was that protection. So many kids don't have access to parks or don't have the ability to take a walk around their neighborhood or have that interaction where they get that out at school.
Can you tell us a little bit about Teen Lifeline's work with teachers and the certification process?
We do a lot of work in the community, a lot of education, and we have, in those 34 years, that's always been a piece of what we do, as well as educating the community about suicide prevention, how to identify someone who might be at risk for suicide, what to do, how to connect to them. And we do that even in classrooms with kids. So one of the trainings, actually, we were approved to be the pilot study to convert their in-person training to a virtual training, in part because all of our staff that work in programs are licensed behavioral health and master's level clinicians. So we're able to convert that program over to a virtual training that has a lot of engagement, a lot of follow-ups. We're making sure that people are safe and connected in their communities. But we're going to be piloting that, and it will meet the requirements. We're right now the only agency that's approved to do that. And that this is going to be a way that we're able to connect with those communities. They don't have the money. There was no appropriations given to the bill, and we provide it for free.
So Nikki, I know Teen Lifeline really depends on its volunteers to fulfill the mission. So how are the volunteers doing?
Our teens have recognized that they do provide this essential service, and their parents understand that. We as volunteers are the only ones that can provide this service that could be the difference between life and death for these kids that call. The kids that call oftentimes are in scary situations or don't have family support. And talking to me could be the difference between life and death. And because of that, I have to be safe, but at the same time understand that I need to sacrifice, and I need to take that risk. It's amazing because my nearly 100 volunteers and their families have stepped up in ways that I don't know that the general public would ever imagine that teenagers and their families would do that.
You know, the purpose of our In the Community conversations is really to reach out to our partners and figure out, you know, how we can specifically help you, you know, and how the community can give back. So are there certain specific needs that Teen Lifeline has right now, and how can we accomplish that?
The things that we need most right now to help us to keep our doors open, to keep doing what we do, is to really support our volunteers. Anything from, you know, we've had some amazing community members who have just donating food for the night for the volunteers from a local restaurant. We have a constant cleaning schedule. Every time a phone's picked up, a computer is used, it has to be disinfected. So any disinfectant wipes, hand sanitizer, alcohol wipes, all of those things we are going through at a very fast rate. So any support that we can have. We do have an Amazon wish list, and people can connect through that.
And then can you also just give us the Lifeline number?
So the crisis number to the crisis hotline is 602-248-TEEN, and actually texting is that same exact number.
Well, on behalf of the Thunderbirds and myself and my family, thank you for everything you're doing for our community, and it was nice chatting with you.
Thank you so much, and thank you to the Thunderbirds. You guys continue to be a huge support, but also we are always in awe of the lengths that you guys go to make sure that our community is safe and connected.